Happy end of February. We have a lot of updates that we want to share with you, so we've provided the information in the email below, and I thought it would just be good to do a verbal touch base. It's been a little bit of time. So first of all, we are very excited that all of our therapist team is 100% fully vaccinated. They all received the Pfizer shot and has been past the window that we feel that it is in effect. So that is some good news for the team and their families, and it's good news for you as we're able to open up some more things to welcome back clients. So I'm going to talk about that in this video. We're going to be talking about COVID patients, clients that have had COVID in the past, people who are vaccinated, some of the health screening questions that have changed, and stay tuned because we're going to be talking about bringing back 90-minute massages pretty soon too. So first of all, if you've had COVID in the past, we haven't been able to massage you. We are at that point where we're able to start welcoming you back effective March 1st. So we've been working on the system for that because again, safety is the number one thing that we want to take into account at Balanced Massage Therapy, and we want you to feel safe, and we want our therapist to feel comfortable massaging you. So what we did is we've changed our screening questions. We're still going to open with, have you ever had COVID? If you have, we're going to immediately move you into our COVID protocol, which is to have you fill out a post-COVID health screening. We have two options. We can email it to you, or we can do it with you over the phone. It takes about 1 to 2 minutes. It's pretty quick. But what it does is a comprehensive overview of your experience with COVID. One thing we've learned through this is that COVID affects everybody individually. And so we want to take that into account. So what we're asking you about is your health history before COVID, during COVID, and in your recovery process. And what that's going to help us do is put you into one of three categories for the most part. We're going to look at the criteria. That's going to be somebody that just had COVID, had no issues at all, is totally back to normal. People that have had COVID maybe had a little bit of issues while they're going through it, maybe a couple issues during recovery, but it's doing pretty well. And then people that have had severe cases of COVID that are still working through things. So long haulers or people that have just maybe aren't in recovery as long, might still be suffering from some respiratory concerns or cardiovascular needs. So what we wanted to do was look to see, is massage compatible for you at this stage in your recovery? And then we asked the therapist to let us know what are they comfortable massaging. So Chris put together this 9-page document on the pathology of COVID and massage and how massage can be adapted for different things, or what are some red flags that we're looking at that we might not actually be able to massage. For example, if you're suffering severe blood clotting right now, massage would not be something that we would be doing. So again, we wanted to pause and get everybody's individual information and then make the assessment for who's going to be the best therapist. So what this means is you might always see a certain therapist and they might not be ready to massage everyone that's had COVID. So we're looking at all the options and we're going to be sharing that with you. We obviously have Chris helping lead the charge as she's in charge of training, working with the team to make sure they're comfortable, and she's going to be the one that we're going to be having our severe COVID clients see first so that she can also get experience and then lead that training back with our team. So as everything, it's going to take a little bit of time to make this completely fluid. But most people we know have had very mild cases of COVID, haven't had a lot of issues with it. And that should be ending up being pretty much like a similar booking. But again, we want to get your health history updates. So we're going to get you in the protocol, we're going to get you booked, and we're going to make sure that we're that massage is the right fit for you and that we're doing it the right way. So we're happy to share that pathology information with you too. In fact, I'll share a link of the PDF in this email so you can review it and see if you have any questions for us or for Chris. The other thing we're doing is we're changing some of the protocols if you've been vaccinated. So when you call, we're going to ask, have you had COVID? If you say no, the next question we're going to ask you is, have you been vaccinated and is it fully in effect? So for us, we're basing this off of Pfizer's 1 week after the second shot and Moderna's 3 weeks after their second shot. So we're training the front desk team to make sure we get the date of your second shot and make sure we're outside of that window. When we are, we're going to be able to kind of get you past the travel restrictions. We currently say if you've been out of the state for 2 weeks. You can't come back in. We're going to be removing that, and we're going to be removing the exposure question. So this is opening back up to frontline healthcare workers. Our team is vaccinated, the therapist team is vaccinated, and if you're fully vaccinated, we feel this is pretty much going to be our new normal, and we want to start working inside of it. We are not changing any of our other safety protocols. We still have a PPP charge. We still have the PPP for the PPE, excuse me. You can tell I've been thinking PPP too. The PPE charge and the equipment for the team. So they're still going to have masks. We're still requiring masks. So what we're sharing with the team is we're not changing our safety protocols. We're easing some of the requirements once people are vaccinated. We will need a copy of your vaccine card. We will make a scan that copy and it will save into your records. Again, we'll learn more as we go, but if we end up getting boosters or however that works, we are going to actively stay in front of that, know what we need to know, and share that with you so that we can keep making sure balance gets as back to normal or finds our new normal as much as possible. So with that said, once we get this rolled out and we have some of the kinks worked out, we're going to be welcoming back 90-minute massages. We don't have a set date. I would look for it in March, and we'll send an email out. We appreciate you guys understanding why we went to 60-minute massages. We are not going to make that a vaccinated requirement. We're going to be opening up 90-minute massages for anybody that wants it. Again, same safety protocol in place. We have the air purifiers in the room to circulate the air. So we feel like this is safe. We've shared this information with our team. We will take into any account if they have any concerns, but we feel that BMT has great safety requirements to allow us to get back to 90 minutes. We might have to adjust some schedules, but again, that's why we're going to pause. We're going to look at that a little bit later once we get our COVID systems all set up and ready to go for March 1st. So we're excited that we're slowly moving back to normal. Again, I can't thank you guys enough for the concern and the care and the kindness that you've given to Chris and I, to our front desk team, to our therapist team. You have made a difference in this most difficult year. We hope that we're able to make a difference in yours as well. We understand some people are waiting to get vaccinated before they come back. And again, I just want to assure you that we respect all decisions that you're making. We understand it's personal. We understand that there's a lot of decision-making variables that you all have in different families or your circles that you run in. And we just want to be here for you when you're ready. So if you have any specific questions about anything I've asked, if you'd like more detail, feel free to email me, josieann3@gmail.com. As always, you can call me, 734-474-4206. I look forward to seeing more of you back. I know the therapist team are looking forward to seeing more clients return as we continue to walk down the road of vaccination, find our new normal, and as always, find balance. Thanks, guys.